Thank you for inviting me. My topic today is well-being, what works. And the reason Robert invited me to talk about this is because, well, I imagine it's because I am the lead academic of the Community Wellbeing Evidence Programme of the National What Works Centre for Wellbeing. And some, but not all, of the research that I'll be talking about today links back to that programme, because a lot of what we're doing on that programme is reviewing evidence and looking at secondary data that is focused very much on place and infrastructure. Not all, but a lot of it is. And I'll be focusing on that particular aspect in the talk. So just a sort of coverage slide, really. I'll be talking about wellbeing, community wellbeing and place, and giving a few definitions and examples of how the things link. A few examples from the Wellbeing Evidence Programme on, if you like, ingredients of community wellbeing, which is a highly complex concept and a very, very layered thing. I'll be talking then, moving slightly to think about sort of more, if you like, psychological aspects of well-being, focusing on hedonic places versus eudaimonic places and the relationship that those have in terms of what we need to do and how sustainable they are. So first of all then, here's some graphs from the ONS 2011-2012 showing very clearly that well-being is a place variable. I don't need to focus too much on those graphs, but you can see that what's represented here are percentages rating personal well-being, of which there are 4 questions, hence 4 graphics here, at the highest levels, ranked by region. And so we see interesting differences, which I won't go into here, in relation to each of those particular questions that you might not have expected. But I think there's a lot of information in there that needs digging down. But very clear, sorry, this is on a timer, I haven't realised. Very clear that well-being is a place variable. Well-being inequality, potentially an even more important subject, just like health inequality, is also a place variable. And this is some of the early work that we did as part of the Community Wellbeing Evidence Programme. And amongst the findings that we showed there was that some areas in the country are doing much worse in terms of the difference between those who are feeling good and functioning well and those who are feeling really quite nasty and not doing so well. So that difference is important, has all sorts of implications for how the place functions and how people, even at the right end of the scale, do in their lives. I won't tell you much about that, but you can link to this via the links on the slides. What we found, though, was that Blaenau Gwent in Wales, unfortunately, was doing the worst in relation to wellbeing inequalities, closely followed by Liverpool, the city where I currently now live. And we see that every day. You notice it, you see it, you pass through it. More information on the fact that well-being, and actually in this case mental ill health, is very much a place variable, goes all the way back to the 1930s and refers to this thing that's sometimes called the urbanicity effect. And this is the fact that both common mental health problems like depression and anxiety and also more serious or severe mental health problems like schizophrenia are more prevalent in cities. And I want you particularly to focus here on the Evans 2003 and LOA et al. Study, which really demonstrated that the relationship between mental distress and urban living is something to do with the perceived quality of place. This is some data that we've been gathering as part of our NIHR Northwest Coast CLARC, with Collaboration for Leadership in Applied Health Research and Care is what CLARC stands for. And this is something that you, of course, will recognise. We measured in a household health survey the relationship of various variables which focused on health and wellbeing inequality. And all this slide shows is that deprivation, of course, is an important factor in determining people's individual wellbeing. In blue, you will see neighbourhoods, areas that were selected for our survey which were considered to be, and indeed are, deprived in the northwest coast area. And in orange are some neighbourhoods which aren't deprived. And as you see, generally the graphic shows that as deprivation increases, so well-being decreases. And you see the same, exactly the same profile with mental ill health, so depression, anxiety, and paranoia, for example. And from the same data source, here we have a sort of very simplified table, really, that I try to put together that looks at how these variables to do with how good we're feeling or how bad we're feeling are actually related to, if you like, place characteristics. And what we see here, if we focus on well-being, we see that having a sense of belonging to where you live, whether or not you use the open space to which you have a resource, and the level of reported incivilities in your area are all really related to well-being. They will predict well-being in that particular area. The strongest of those associations is in level of reported incivilities. If there's lots of, if you like, antisocial behaviour going on around you, your well-being is going to be affected. And finally, here's a poll by Demos, again stressing that aligned with the data, people know that where they live, the quality of where they live, affects how they feel. This is some research by Demos in 2007, and this was a poll of relatively young people. So it's very clear from all of those sources that we're talking about something that has something very, very clearly to do with the quality of places in which we live. The graphic underneath is just a piece of art by Abigail Reynolds, which I believe is Chicago, a representation of Chicago. And the peaks, I'm sorry about the timing, the peaks on the graph, on the piece of art here, show areas where people feel scared. So the city can be graphed artistically in this kind of way, but also very meaningfully, because it's exactly those areas of threat where we would expect to see low well-being and mental distress generally. The fact that this has something to do with quality or desirability is something that you can look at using really quite traditional psychological methods. I'm a psychologist by training. One of the things we were interested in doing in this study was to give people different pictures to very, very quickly contemplate. Would you like to live there? How nice is it? Very simple contemplation questions. And we were interested to see whether or not changes in what are sometimes called psychological mechanisms that underpin how we feel, how distressed we feel, or how well we feel, change in response to looking and contemplating those photographs. And to cut a very long story short, what we found was when we contrasted rural areas to urban areas, which were matched in terms of perceived desirability, how much people liked them, we found no change in the mechanisms that underpin depression and anxiety and well-being. So contemplating those places didn't make a difference. So that told us it was nothing really to do with greenness. So not anti-urban. On the other hand, when we contrasted two places that were differentiated, not in terms of greenness, they were matched in terms of rurality or greenness, but instead in terms of perceived desirability. These are the images that we used that were perceived to be more desirable, and these ones less desirable. And what we saw there was changes in the mechanisms, some of the mechanisms, not all, some of the mechanisms that underpin mental distress and mental well-being. So in other words, again, it seems to be something to do with desirability, not urbanity, that's driving this thing, if these studies are correct. The strength of this study is that it is a lab-based study. You might think it's not a strength, but it is, because it shows us that even when you're just contemplating photographs, you don't have to live there, you've just got to think about the places. We can make changes to how people are feeling internally. That's a very, very powerful result. So we did also a study where we walked people through a 2-mile route of South Liverpool to get at pretty much the same thing. But what I want to talk to you about today in relation to this study is how, when you move through different places, you can actually ask people what they're noticing, what's salient to you, what's driving your attention, and therefore determining how you feel. So that's the route that we walked through, and you'll notice that it walked through different areas which have different levels of deprivation and different levels of need. And this is what people tended to notice. We asked them to take photographs. And you'll be familiar with these kinds of scenes, and you might not be surprised by the things that people are noticing as they walk through relatively leafy suburbs. Here, they're noticing the relative leafiness of things and generally feeling probably that it's quite pleasant. And here, we're seeing more obvious signs that people are noticing deprivation, if you like, or lack of management of place. Not always, because somebody took a photograph of this rather nice street leading down to Edge Hill Station. And you can transform those photographs, because we also ask people to describe these salient features. And this here is a sort of shopping restaurant lane in the leafier part of the walk. And this one, quite similar architecturally, but you can see much more run down, and actually a more lively lane in the more deprived area. And you'll see what we've tried to do here is to highlight the kinds of words that people are using in relation to walking through and stopping in those particular spots. So very clearly people notice these things. I mean, it's no surprise. This is what people are noticing as they go through places, and what people attend to affects how they feel. That's how we work. I'm going to move now to just briefly go through some definitions of well-being. So first of all, the simplest definition of well-being, as, for example, the ONS will use it, is feeling good and functioning well. And that's something that we can all understand, and there's no need really to go any more complicated than that. But of course, feeling good and functioning well depends on having access to the things that make life worthwhile. And one of the personal well-being questions that ONS uses, of course, is how worthwhile is your life? How satisfied are you with your life? If we drill down into the more psychological aspects of a well-being, and this is really drilling down only to level 1, and we start thinking about the different approaches to deriving well-being, there is the hedonic approach to deriving well-being, and this is where your well-being comes from essentially striving for maximum pleasure and minimum pain. And it's a very dominant strategy, particularly in young people. We tend to grow out of it as we age, but not everybody does, but there's a tendency for that to happen. But it's a very short-term well-being strategy. These are like the well-being hits that we get from the various things that we choose to do, and like eating cakes, for example. And what's more, it's quite resource depleting. When you think about it in terms of place, it's a resource depleting mechanism from which to draw well-being. It uses up the resources that we need to sustain successful places. Need more hospitals, for example. It contrasts with the eudaimonic approach to well-being, where well-being comes from the pursuit of meaningful goals. It often involves the sense of transcending your, if you like, hedonic needs for the sake of the greater good. Often, but not always. It's a much longer-term well-being strategy. This individually you can sustain for longer. And when you think about it in relation to place, it's sustainable, much more sustainable. And there's data to demonstrate that. So those are the definitions of well-being that I'm going to be talking about or referring to in the talk as I go forward. This is some work that we did as part of the Community Wellbeing Evidence Programme in the original collaborative development phase of that piece of work. We asked professionals from cross-sector who thought that well-being was part of their work remit, if you like, and we asked them what's meant by the term community wellbeing. And you can see here that the majority of people, they weren't forced to only choose one definition, but the majority of people believe that community wellbeing is something to do with strong networks of relationships and support between people in a community, in close relationships and friendships, but also with your neighbours and acquaintances. Other people said various things, and here's just a graph of that particular set of data as we collected it. Down at the bottom here, you see some people, I imagine they were planners or built environment professionals, saying that community wellbeing is something that emerges from physical surroundings that enable people to flourish. Well, my own view is that, of course, it will. And actually, when you go around trying to graph what people believe, really this is demonstrating something very layered and very complex. These are, in the same piece of work, the kind of factors, the kind of determinants that people feel need to be represented when you're thinking about something as complex as community wellbeing. And so you can see just here, without even reading any of them out, that this is a highly, highly complex area. Right in the middle here, built environment and planning, but we also have reference to green space, local services and amenity, housing, crime and safety, transport. Those are the obvious ones, but not, of course, the only ones that relate to the urban design profession. We asked also for these same professionals that we surveyed to, if they could, give us a relevant example of a real-life setting that they know of where they think there is a high level of community wellbeing. And we asked them to explain why or how this wellbeing is apparent. And we did some analysis, some thematic analysis of the answers that people gave to this question. And they thematised down into exemplars of places, catalysts, so what catalyses that community wellbeing, and sustainers of community wellbeing. How do we get it to last? And here are just some examples of each of those categories. I hope you can read that okay. And what I've tried to do is to pick out the ones that clearly relate to urban design, built environment profession, the living environment, and so on. So up here as an exemplar, people regarded that community wellbeing came about when the people that live in places claimed their public realm, where they did something in the place that they live, and the place that they live became the focus of their activity. So there's a couple of examples up there. I don't have time to read them all out, but local groups taking over pieces of unused green space, spread and growth of playing out activities, and a tower block where one particular champion decided he was going to make things better for other people. Catalysts include things like a chance for positive change. So regeneration initiatives are a chance for positive change. They don't always work, but they're a chance for positive change. The idea that what you have in a place is an agentic community, a community that feels it has choices and can make those choices. And pride in place, of course, is very important. And there's just a few examples of quotes that fell under the category of catalyst. And then finally, sustainers. So organic places were mentioned here. Things that work as communities. Particular places that the physical surroundings enable people to flourish. Design of older streets with closely joined houses, etc. Partnership ethos. So working in partnership as part of a common good partnership. And finally, developing a sense of belonging. These are the things that sustain community well-being beyond the original catalysing element, according to our professionals that we surveyed. What about people? So when we ask everyday people what they think about their places, we get a robust and pretty predictable answers in relation to this. We use something called an airing line approach to collect this data. because it's fun and people like doing it. And what you hear is, I've never been asked this before, and people find these questions really quite difficult, which is surprising, and they shouldn't, but they do. When you rank the answers that you collect using these kinds of questions, what makes a good place? Community spirit, good people and neighbourliness, this idea that it's in the people relates to a good place. And then second, nature and open space is very important for people. And finally, clean living environment. But by far and away the most common response was thematised according to this people type theme. When we ask them where do you go to feel better, nature and open space takes over then. So if you're feeling rubbish, a bit rubbish, you can go off and you can go and enjoy something that might be restorative. Family and friends are still there. We go to the people we know we can rely on and we know who love us. And finally, private activities and diversions was the third most common theme there. And even more difficult question, where's your dismal land? Fewer people in this particular survey answered this. But again, interesting things coming up. So aspects and features of city living, queuing, pollution, all those kinds of things. People hate, absolutely hate it. Matters of governance and politics, people making bad decisions for other people. It's infuriating, we know that. And finally, I was surprised actually being alone only surfaced as number 3. So these are all features about how we design our places. The first two are anyway. So that's what real people think. I'm going to move on now to talk a little bit about some of the evidence that we've reviewed as part of the Community Wellbeing Evidence Programme. When we did our collaborative development phase, a number of topics came up, and most people wanted us to have a look at the evidence around housing and well-being. And we had a feeling that there probably wasn't going to be much high-quality evidence in this particular area, or indeed in the area of community well-being at all. And so we scoped the reviews that existed in the area, first of all. And most of the evidence in relation to housing and well-being actually comes from the States, not from the UK. And of course we know that context and the governance of the kind of decisions that are made in relation to housing are also very important in relation to well-being. So where the evidence comes from is really important, and we must bear that in mind as a potential caveat here for this kind of research. But again, you can access this if you go onto the What Works Wellbeing website. It's all there for you to see. I just wanted to point out a number of things in relation to housing and neighbourhood regeneration, which tended to happen within the same reviews. Urban regeneration can be both good for well-being but also bad. We know that's the case. Things done to people that they don't want done to them never makes people feel good. Community engagement initiatives and neighbourhood institutions are generally good for community well-being, according to this scoping review of reviews. Some of the other work we're actually going to be producing a systematic review looking at well-being implications for vulnerable people, and that's coming up in the programme later. This is a piece of work looking at how well-being is encouraged, or community well-being is encouraged by trying to improve social relations. I have no idea what that paper's about. I'm just going to ignore it. Years ago. I'll hurry up. So this is a scoping review of social relations. It's a very important topic, and again, key when it came up in terms of what people wanted us to have a look at. Neighbouring is referred to by Joseph Rowntree Foundation. The Legatum report wants more evidence around how we link the physical environment and social relationships. We found 34 existing reviews, but no systematic review yet on how is it best to boost social relations through places and spaces in communities. So hence we're going to go on and do something more focused on that particular question. This is just some things that will be appearing soon from this evidence programme. Very important for me, a conceptual review. Fully complex and layered, a full description of what this idea of community wellbeing actually means. It won't be to everybody's taste, but it's an important document for us to have produced. A toolkit for community groups around wellbeing in green spaces. Some work, actually the scoping review on wellbeing and co-production is already out, but again a more systematic review of that particular question we'll be doing. Secondary data analysis of various surveys that are carried out annually in the UK, looking at the question of what drives well-being and well-being inequality, and there's some ability for us to look at changes in those drivers or potential drivers and responses in terms of personal well-being for people living in those areas. So lots of rich stuff about to come out in this programme, and I would urge you to keep an eye on it if you're interested in this area. I wanted to talk very briefly about some work that we're doing as part of Halton Lee NHS Healthy New Town. We've been engaged, Pro-Social Place has been engaged to run some community engagement for the people of Halton to judge what they think it means to have a healthy new town. This is just some evidence that we've managed to put together for this conference, actually, on the basis of what 73 young people told us about health, well-being, and placemaking workshops. So for these young people, as I was saying before, happiness and positive mindset. In other words, they have a hedonic idea of well-being, very much about making them happy, rather than having meaningful places. People in relationships, again, was a key feature in this, but also the young people referred to the ability to engage in their hobbies, to have physical activity, and rest and recreation was clearly important too. Barriers to health and well-being included lack of cleanliness of the place came up time and again, so something to do with management and stewardship of places, safety, money, job opportunities. Place stigma was big in the room, so people know what I'm like, I come from Halton. So place stigma turning into self-stigma is a really important process that we need to be thinking about rather more. How do the places we live in affect our health and well-being? There's this idea of noticing mess again. It was very important to this young group. Feeling scared and vulnerable was really important. Not surprisingly, feeling threatened is going to affect your well-being. Getting around was important to young people. Transport was expensive and a bit rubbish. And having nothing to do. Well, we always hear teenagers complaining about having nothing to do, and they did so also in Halton Lee. What makes a good place for everyone? So these young people, themes around activities for all, around a sense of community and neighbourliness, a sense of belonging in the environment you're in is very important to stay happy. If people around you are happy, it will have a positive effect on your life. Safety, traffic and transport was important to young people, and again, a clean and pleasant land. So some clear themes there in terms of how we should be managing places to keep these young people feeling good and functioning well. But what about making meaningful places? So that's some idea about how to make places that might keep people happier. But what about making meaningful places? So we use something called life history theory to try and work out how we can make places better for people in a more sustainable way. And life history theory really shows how the qualities of an environment can actually directly determine the life strategies that we take and our well-being because of that. And so it emphasises very much the importance of place design. And to cut a long story short, it argues, and it comes from evolutionary psychology, that where resources are stable, reliable and predictable, people plan for their futures and they develop the capacity to adapt to inevitable life stresses, and they tend to cooperate with other future-oriented people in their communities too. They have the resources to do that, and so they do, and that makes their life meaningful. When resources are more unstable, perceived to be unstable, unreliable and unpredictable, you get a much more hedonic kind of lifestyle coming out. Thrill-seeking. People look for their hits when they can get them because they don't know where else they're going to get them from, and they know that they probably can't sustain it. So in other words, harsh environments and the behaviours they prime have significantly negative impacts on sustainability. And so the way we make places must be more to do with meaningful places and creating those rather than, I think, happy places. So how do we do that? Well, I've argued recently, again, this is a blog on the What Works Wellbeing site, that in order to be able to do that, we need to make our communities of place into our communities of interest. We have to get people who live in the places to regard their place as their commons, the places where they come together and interact with other people in a meaningful way, often around the aspects of their place. And this aligns very much with Cresswell's really nice definition of essentially places as spaces with meaning. So a place is a space with meaning, and that works at all sorts of different levels when we think about place making. And what we're trying to achieve is sometimes, is always what philosophers sometimes call we-ness. This first-person plural perspective. We-ness is generated out of social interaction, but it exists beyond that as a concept that is about cohesion, group cohesion. We-ness is a phrase I rather like in relation to this. And how do we make, again, meaningful places? Well, at a number of levels, creating we-ness in terms of how we govern places is very important. So ideas around town teams and place directorates, I think, are extremely important. And this is just an early example of that, Lambeth's Wellbeing Network, which was established, in fact, in 2010. I don't know whether it's still going, but it was the first time in Lambeth where planners began to talk to public health specialists. And involving people in co-design, in design charrettes, whatever you want to call them, the more immersed they are, the more likely they are to generate a community of interest around their own places. And this is just the work that we did for a social enterprise called the Reader Organisation in Liverpool, who'd taken over essentially a toxic asset. It was an old mansion house in the middle of a park, rather derelict and run down. Their job is to bring it back to life with an ethos around shared reading and well-being. And it's important that when we do this, that we measure change rather better than we are doing now, because the evidence from the What Works programme shows that we're really not doing this very well. That's nobody's fault. It's a young discipline, but we need to learn to do it better. And so we've developed an iterative theory of change, which you can see here, but we've also produced a systematic scoping review of indicators of community wellbeing in the UK. So if you want to begin to evaluate the changes that you make, then we are producing resources to enable that to happen rather more effectively than it has done in the past. And so, in conclusion, we know what we want to achieve, and we know it when we see it. Everybody knows it when we see it. And we know some of the key ingredients of it too. So what do we need to do? We need to maintain the focus on how place can enable sustainable well-being, meaning and purpose, and not just happiness. So these polemics around happy place, I think we need to push back on a little bit. We can change our practice to enable place co-production so that communities of place become communities of interest, and so you get the sustaining element. And we can change our governance systems to enable a togetherness when we think about places. You know, what if we're all one local authority and we do all of this together and it's place focused? And that's me.